poor circulation, memory loss, and even heart failure. All of this can start with something as mundane as waking up with a dry mouth. Most people roll over, grab a glass of water, and start their day. But what if that dryness had nothing to do with thirst? What if it was your body sending you a warning it's been trying to deliver for months, even years, and no one ever taught you how to read it? Here's what stops me every time I think about it. Chronic morning dry mouth affects nearly 1 in 3 adults over the age of 60. And in the vast majority of cases, it has absolutely nothing to do with how much water you drank the night before. Nothing. And yet, it's not a conversation happening in most pharmacies. It's not a conversation happening during most annual checkups. It's simply not being had. Stay with me until the end, because the number one cause I'm going to share with you today is something quietly sitting in your medicine cabinet or on your bedside table right now, and it could be causing far more damage than just drying out your mouth. We're talking about something with the potential to affect your kidneys, your heart, and your brain simultaneously. I'm Dr. Ene, a physician with over 10 years of clinical experience dedicated to the health of adults over 60. During this time, I've consulted with countless men and women who came to see me for something that seemed minor, only for us to discover a serious underlying condition hiding behind that overlooked symptom. Morning dry mouth is exactly that kind of symptom. Deceptively simple on the surface, potentially life-altering beneath. What I'm about to share with you challenges something most of us have been silently conditioned to accept. That aging means discomfort. That a dry mouth is just what you feel as you get older. I'm going to be direct with you. That's not the whole truth. And after 10 years of watching patients suffer unnecessarily because this information never reached them, I'm no longer willing to stay silent. If this resonates with you, hit the like button now. It helps reach the people who truly need it. Let's talk about what's really happening inside your body on those mornings you wake up feeling like your mouth is full of cotton. Your mouth relies on a continuous supply of saliva, and saliva isn't just water. It's a sophisticated biological flow carrying enzymes, antimicrobial proteins, minerals, and protective compounds that defend your teeth, gums, throat, digestion, and immune system 24/7. When the salivary glands start to slow down, or when other systems in the body start to struggle, saliva production drops. And when it drops significantly, your mouth dries out, especially at night when you're not drinking, talking, or doing anything to naturally stimulate saliva flow. After 60, your body already produces about 30 to 40% less saliva than it did at 40. This reduction alone creates real vulnerability, but it becomes truly dangerous when combined with the 7 causes I'm about to reveal, because none of these causes just dry out your mouth. Each one points to something deeper happening in your body. Here's what concerns me most as a clinician. Chronic dry mouth is associated with a 45% higher risk of systemic infection in adults over 60. Saliva is your mouth's first line of immune defense. Remove it, and bacteria, fungi, and viruses get direct access to your bloodstream. So let's go through the 7 causes, from least to most concerning. And by the time we're done, you'll know exactly what to watch for, what to tell your doctor, and what you can do differently starting tonight. Before we begin, I want to ask you a personal question. How long have you been waking up with a dry mouth? A few weeks, several months, years? Leave your answer in the comments below. I read every one. And your response might help someone else watching this realize they're not alone. Number 7, mouth breathing during sleep. Before you dismiss this as obvious or harmless, I need you to hear something important. Mouth breathing during sleep is almost never just a habit. In my clinical experience, it's almost always a symptom of something else, and that distinction is extremely important. When you breathe through your mouth at night, air flows directly over your tongue, palate, and the back of your throat. This constant airflow evaporates moisture at a rate your salivary glands simply can't keep up with while you sleep. The result? That sandpaper feeling in the morning, chapped lips, a thick or pasty tongue, sometimes even a sore throat that has nothing to do with illness. But here's what concerns me far beyond the dry mouth itself. Mouth breathing during sleep is frequently caused by nasal congestion, a deviated septum, nasal polyps, or sleep apnea. and sleep apnea in particular is not something to minimize. Research shows that untreated sleep apnea is linked to a 60% increased risk of stroke and a 40% increased risk of heart failure. If you wake up with a dry mouth and you also snore, don't feel rested after a full night's sleep, or someone close to you has noticed you sometimes stop breathing at night. Please don't dismiss this as just your way of sleeping. Talk to your doctor about a sleep study. This one conversation could be more important than you think. For those whose mouth breathing isn't linked to sleep apnea, practical solutions are simple and effective. A nasal strip worn across the bridge of your nose before bed can significantly increase nasal airflow, encouraging your body to breathe as it was designed to. A humidifier in your bedroom set to 40 to 50% humidity drastically reduces nighttime moisture loss. Sleeping on your side reduces the tendency to mouth breathe. A small piece of surgical tape placed vertically over your lips before sleep, a technique used by sleep specialists for years, gently retrains mouth breathers to nasal breathing. Many people notice a real difference within the first week. Number 6. The mistake that seems totally logical, until you understand why it doesn't work. Most people who wake up with a dry mouth assume the solution is simple: drink more water before bed. So they do exactly that. They finish a big glass right before turning off the light, and wake up just as dry as before. Sometimes even more frustrated because they did everything right, and nothing changed. Here's why. Your body doesn't hydrate in real time. When you drink water, it takes 30 minutes to 2 hours for that liquid to be absorbed, distributed to your tissues, and made available for functions like saliva production. Water consumed at 10 p.m. does almost nothing for your mouth at 6 a.m. the next morning. The window has already closed. The real problem is what did or didn't happen earlier in the day. One study found that adults over 60 who didn't maintain adequate hydration 16 hours before bedtime were 62% more likely to suffer from significant nighttime dry mouth, compared to those who stayed consistently hydrated throughout the day. 62%. That's not a small difference. And after 60, it becomes harder to manage naturally because the body's thirst mechanism becomes genuinely less reliable with age. You can be significantly dehydrated without feeling any particular urge to drink. Many people also quietly reduce their fluid intake in the afternoon to avoid nighttime bathroom trips, which is understandable, but it creates a hydration deficit that peaks precisely when you have no way to correct it. The solution isn't to drink more water at night, it's to front-load your hydration earlier. Aim for 180 to 240 milliliters, 6 to 8 ounces, with each meal and snack in the afternoon. And here's a simple but effective pro tip. Add a pinch of sea salt and a squeeze of lemon to your afternoon water. This supports electrolyte balance, helping your cells actually retain the fluid you consume, rather than letting it pass right through. Number 5. The nutritional deficiency. Almost no one considers. Your salivary glands aren't passive structures. They're metabolically active tissues that require specific nutrients to function properly at the cellular level. And 2 particular deficiencies degrade salivary gland function in adults over 60 faster than almost anything else. The first is vitamin A. This nutrient is essential for maintaining the health and integrity of every mucous membrane in your body, including the lining of your mouth, throat, nasal passages, and digestive tract. When vitamin A levels drop, these membranes become thinner, drier, and progressively less functional. Research has revealed that adults over 60 with low vitamin A levels had a 41% reduction in resting saliva production compared to those with adequate levels. That's not a subtle effect. It's your salivary glands operating at a fraction of their capacity. The second involves B vitamins, particularly B3, niacin, and B12. Niacin deficiency directly disrupts the nerve signals that trigger saliva production. B12 deficiency leads to an inflamed, abnormally smooth, and constantly dry tongue, a condition called glossitis. Together, they create dry mouth that no amount of water can fully resolve because the problem isn't hydration, it's cellular function. After 60, B12 absorption drops significantly due to reduced stomach acid production. And research suggests that up to 30% of older adults have insufficient B12 levels without the slightest clue. For dietary sources, Focus on sweet potatoes, dark leafy greens, and eggs for vitamin A. For B12, prioritize lean meats, fish, and dairy. For many adults over 60, supplementation is also necessary. Look for a B complex containing at least 1,000 micrograms of methylcobalamin, the most bioavailable form of B12. And a pro tip: vitamin A is fat-soluble, meaning it's absorbed far more effectively when consumed with a small amount of healthy fat. A drizzle of olive oil or a few slices of avocado with your meal makes a real difference. Number 4. The combination I take most seriously in my practice. If this applies to you, I want you to hear it clearly, not with fear, but with the understanding that early detection changes everything. If you wake up with a dry mouth and you also get up to urinate more than once during the night, this combination is a clinical red flag I never ignore. Together, these two symptoms are among the earliest signs of uncontrolled blood sugar, and in some cases, undiagnosed type 2 diabetes. Here's the mechanism. When blood sugar exceeds a certain threshold, your kidneys work overtime to filter and excrete the excess glucose. To do this, they pull water from your body's tissues. This internal fluid loss dehydrates you from the inside out, and one of the first places you feel it is in your mouth at night, when there's nothing you can do to compensate. What makes this so important is the timeline. Research has found that morning dry mouth was reported by 63% of adults newly diagnosed with type 2 diabetes, and most of them had experienced this symptom for over a year before their diagnosis, over a year during which their body was signaling that something was wrong every single morning. I think of one of my patients, a lively, active retired woman in her 70s who came to see me for something entirely unrelated. She mentioned dry mouth almost as an afterthought on her way out. I asked a few targeted questions. Did she wake up at night to use the bathroom? Yes, regularly. Unusual afternoon fatigue? Yes. I ordered a fasting glucose test that same week. Her result came back at 148 milligrams per deciliter. She had type 2 diabetes and had been living with it undiagnosed for over a year. Within 4 months of targeted dietary changes, daily physical activity, and supplementation with berberine and magnesium glycinate, her fasting glucose was normalized. At her follow-up, she told me, "I finally feel like my body is working with me again." That's what early detection looks like. It's not a crisis, it's an opportunity. Number 3. The condition that affects 4 million Americans, yet takes 3 years to diagnose. And yet, the average patient waits nearly 3 years between when their symptoms begin and when they finally receive a diagnosis. 3 years. This isn't a gap in medicine. It's a gap in the conversations happening in exam rooms. The condition is called Sjogren's syndrome. It's an autoimmune disease in which the immune system mistakenly attacks the body's own moisture-producing glands, primarily the salivary and lacrimal, tear glands. The result? Persistent dry mouth, chronic dry eyes, difficulty swallowing, and in more advanced cases, systemic involvement including joint pain, fatigue, and effects on the kidneys. And women over 60 are disproportionately affected, representing nearly 90% of diagnosed cases. So why does it take so long to identify? Because each symptom is treated in isolation. Dry mouth is attributed to aging or dehydration. Dry eyes are blamed on screen time or seasonal allergies. Joint pain is labeled as arthritis. No doctor connects the dots, and the underlying autoimmune process continues unchecked all that time. The diagnostic clue I want you to keep in mind is this. If your dry mouth is regularly accompanied by eyes that feel dry, gritty, or burning, and especially if you're a woman over 60, ask your doctor specifically about Sjogren's syndrome by name. A blood test measuring 2 specific antibodies, anti-SSA and anti-SSB, can confirm the condition in most cases. You have the right to request this test. Don't wait for someone to suggest it. There's no cure for Sjogren's, but there are effective treatments that manage symptoms and significantly slow progression. And for immediate relief while you seek answers, sugar-free gum containing xylitol is one of the most accessible over-the-counter tools. It stimulates saliva production while simultaneously inhibiting the bacteria that cause cavities, which dry mouth encourages. Number 2. The connection. Most people would never make. Your salivary glands don't operate independently. They're governed by the autonomic nervous system, particularly the parasympathetic branch, which oversees the body's rest, recovery, and digestive functions. When this system is compromised, salivary activity decreases, and your mouth dries out. What makes this significant is that autonomic nervous system dysfunction is a recognized early feature of Parkinson's disease and Lewy body dementia, and research has shown that these autonomic changes can appear 4 to 6 years before the classic motor symptoms that typically lead to a diagnosis. I think of one of my patients, a retired man in his late 60s, methodical and quietly observant. He'd mentioned persistent dry mouth during several visits. We'd gone through the obvious explanations: medications, sleep position, hydration. Nothing fully resolved it. Then, during one appointment, his wife mentioned almost in passing that he'd stopped recognizing the smell of his morning coffee. He'd noticed it too, but hadn't said anything, assuming it was unrelated. It wasn't unrelated. I referred him to a neurologist. Imaging confirmed early-stage Parkinson's. He was shaken, but because we caught it early, he was able to start neuroprotective therapy and develop a care plan long before significant motor symptoms developed. 3 years later, his quality of life remains genuinely good. At a recent visit, he told me, "I almost didn't mention the dry mouth. I thought it was too insignificant to bring up." Nothing is too insignificant to bring up. Your body is communicating constantly. Our job, yours and mine together, is to learn how to listen. Number 1. The most common cause, and the most overlooked. Over 500 commonly prescribed medications list dry mouth as a side effect. Over 500 for adults over 60 who take an average of 5 or more prescriptions daily. The cumulative impact on salivary function and brain health can be profound. The classes of medications most frequently responsible include antihistamines, antidepressants, blood pressure medications, bladder medications, antipsychotics, certain painkillers, including muscle relaxants. What makes this truly dangerous is a concept called anticholinergic burden, the cumulative neurological effect of multiple medications that block acetylcholine, a key neurotransmitter. A high anticholinergic burden has been linked in multiple large studies to accelerated cognitive decline and a significantly increased risk of dementia. Dry mouth isn't the endpoint. It's the visible signal of something happening much deeper. I think of a patient, a retired man in his mid-60s, who described waking up every morning feeling like he'd swallowed cotton. He'd been on the same combination of medications for years. Not one prescribing doctor had ever reviewed the full list together. A medication reconciliation identified 2 drugs with overlapping anticholinergic effects, both of which had safer alternatives. We made 2 substitutions. Within weeks, he noticed the difference. In 2 months, he told me, "I wake up like a normal person again, and my thinking feels clearer than it has in years." It wasn't a coincidence. Your action plan starting tonight. Stop all over-the-counter sleep aids containing diphenhydramine. Melatonin, 0.5 to 1 milligrams, is a far gentler alternative. Run a humidifier at 40 to 50% humidity in your bedroom. Front-load your hydration throughout the afternoon. Brush your teeth with a fluoride toothpaste formulated for dry mouth before bed. Try a nasal strip tonight. This week, write down every medication you take and bring this list to your doctor. Ask directly, does any of these suppress saliva production, and is there an alternative? You're not broken. Your information was simply incomplete. And starting now, that changes. If this helped you, hit the like button. Subscribe to this channel for more real health solutions designed specifically for adults over 60. And share it with someone you care about, a friend, family member, or spouse. You might just give them the information that changes everything. And I want to hear from you. Which of these 7 causes surprised you the most? Which one made you think, that could be me? Share your answer in the comments below. I truly want to know your story, because remember, aging doesn't take away your body's ability to heal. It just reminds you to take care of it the right way. Take care.